Hi, my name is Kayla, and I'll be doing the enteral medication administration assessment video. So first, I have gathered all my supplies. I got my medicine, washed my hands. I'm going to do my first check before I crush it, so I'm going to pour it in here. And the medicine that I'm administering is Ativan, which is also called lorazepam, and that can be crushed. And on the MAR, it says every 6 hours as needed for anxiety, and my patient has stated that they are having anxiety, so I'm going to administer this med to them. So that would be my first check. Crush up the med and put it in the little cup, and then I'll do my second check. So I'm going to check again. It's Ativan 1 milligram every 6 hours as needed for anxiety. And my patient has stated that they have anxiety, so I'm going to administer this med to them. So that would be my second check. And now I'm going to take my MAR and my crushed med over to my patient's room. So knock on the door, hand hygiene, pull the curtain for privacy. Hi there, my name is Kayla, and I'm a student nurse, and I'll be administering your Ativan today. Can I go ahead and check your name badge? Can you tell me your name? Very good, and your birth date? And is there any allergies that you are aware of? No? Okay, perfect. And I've checked my patient on my MAR, and this is the right patient, the right dose, the right route, the right time. And so first, what I'm going to do is I am going to go ahead and I'm going to look at their feeding tube, and I'm going to check for the placement and aspirate some of their gastric juices to make sure that there's no residual in there. So first, this is gloves or wash hands and everything. And I'm going to put this on, and I'm going to aspirate until I don't have any more fluid coming. So it's all looking good here, and I'm going to put it back in. And then I'm going to close this. And what I'm going to do is I'm going to put air in here. Oh, yes. And I'm going to go ahead and put this on their stomach. And I'm going to go ahead and I'm going to listen for placement. Okay, so I heard gurgling in the stomach, so I know that's the right place. And before I put the medicine in here, I'm going to do my third check, and I'm going to make sure that this is Ativan 1 milligram every 6 hours as needed for anxiety, and my patient has stated that they're having anxiety. So next, what I'm going to do is I'm going to fill up my syringe with 30 mLs of water to flush the tube. Okay. And I'm going to clamp this off before I open it. Okay, I'm going to go ahead and flush with 30 mLs of water. I'm going to clamp again and put the cap back on. Now I'm going to go ahead and draw up 30 mLs of water, and I'm going to inject it into my cup to mix my med. And then I'm going to drop that back up in my syringe. Okay, now I'm going to go ahead and I'm going to clamp again and take would also educate my patient that this is a drug for anxiety. It can cause dizziness or drowsiness, and that this medicine should be taken with food. Next, after I administer the med, I would go ahead and drop another 30 mLs of water to flush the tube. So I'll clamp the tube, open this up, put the syringe in, unclamp, and flush the line. Clamp again, and recap. Okay, so after I've done that, I would go ahead and I would want to document on my mark that I administered the med, and I would also document that I aspirated and put that back in, and that I administered 30 mLs for the flush and 30 mLs for the med, and the flush was before and after the med.